Donald J. Trump is calling for a total and complete shutdown of Muslims entering the United States until our country's representatives can figure out what the hell is going on. We have no choice. We have no choice.
That is Donald Trump when he made his initial announcement about banning Muslims from entering our nation. He later backed off those comments just a bit by saying Muslims that are not U.S. citizens should be banned from our nation. This leads me to a recent poll by Fox News when people were asked, do you favor or oppose temporarily banning Muslims who are not U.S. citizens from entering the United States until government officials can say with confidence they can identify those who are coming here to cause the country harm. And Donald Trump's name is not invoked in the question. When it's not, 55% of Americans favor banning non-U.S. citizen Muslims from entering our borders. But here's what's really stunning from this poll. When Democrats were asked the exact same question, when you didn't invoke Donald Trump's name, 45% of Democrats also favor banning non-U.S. citizen Muslims. But if Trump's name was invoked, only 25% of those Democrats support it. So clearly the fear people are feeling is growing across both political spectrums, and it shows as long as Trump's name is not invoked, people are saying, yeah, this is probably a pretty good idea. Here's the big thing. Many people are questioning the constitutionality of Trump's statement. And let's keep this in mind. The Constitution and the Immigration and Nationality Act of 1952 give both the president and Congress a lot of power to keep people out of our country for any reason they deem necessary. So with us now to discuss the constitutionality of this and also the impacts this can have on our healthcare system is the executive director of the Association of American Physicians and Surgeons, Dr. Jane Orion. Dr. Orion, thanks so much for joining us. Your thoughts on, is what Mr. Trump said constitutional or not?
Well, there's nothing in the Constitution that gives non-citizens any rights whatsoever. There have been times in our history when we didn't let anybody in the country. At the present time, Obama is keeping out Christians, even though they're being clearly persecuted, and no one's raising a constitutional issue about that. FDR kept out Jews. I think that was a horrible thing for him to do, and most of them got killed in Nazi Germany because of that, but there was no constitutional issue about it. So whether it's what you want to do is separate from whether or not the Constitution permits it here.
So let me ask you this. Do you support what Donald Trump is suggesting?
I think that we really need to control our borders and to be conscious of who we are letting in the country if they may be a threat to us, whether from the health standpoint or from the violence standpoint. Then I think that we have to have a policy that will protect our citizens.
Now, you're in Arizona. You obviously see a lot of the immigration situation that's taken place as well. What I want to hear from you is you mentioned the health aspect of things. There's now reports coming out that Syrian refugees are bringing flesh-eating diseases into Turkey and Lebanon. I think it's called leishmaniasis. I may be saying that correctly, so you can correct me if you want. But your thoughts and comments on, are we doing a good enough job, obviously, to monitor the people that are coming in from a health perspective?
Well, the ones who are coming in illegally are not being screened at all, of course, so they may be bringing in drug-resistant tuberculosis. Chagas disease is getting to be a problem that's carried by kissing bugs, which exist here in this country. And then this leishmaniasis, that is something that hasn't been seen here for a long, long time. It's coming into Europe, and they are not familiar with it there either. Syrians, unfortunately, seem to be very much afflicted with that, and they're bringing it into the countries where they're going. And unfortunately, most physicians probably don't recognize it. There isn't any really good treatment for it, and it may not be apparent for several months when the person is carrying it and could be transmitted by the sandfly, but they don't have the skin lesions that make it apparent.
You know, with the doctors that you visit, the hospitals you go into, what's the impact that you're seeing on emergency care or hospitals as a whole as more and more people are illegally coming into this country?
Well, many hospital emergency rooms have had to close because the hospitals simply cannot carry the expense of being required to treat free of charge just anybody who walks through the door. And if we let illegal people in, they can go to the emergency room and they will get treated. So this is already just shut down many hospital emergency rooms. The waiting list or the waiting times are getting longer and longer. And I guess I cited in my editorial one case of a man who was lying on the floor of our emergency room for more than 7 hours before he left without being seen. He was complaining of severe pain, and he came back to another hospital later, and he died.
What?
Nobody had checked on him. A security officer brought him a blanket, but nobody looked at his leg. Nobody rechecked
What
his
hospital was
temperature.
this? Where was this?
This was in Tucson. It was one of our supposedly really good hospitals. And just how many people were there who were in the country illegally, I don't know. But certainly the hospitals have not been able to staff themselves well enough to take care of the flood of people that is coming in.
Dr. Jane Orion, thank you very much for the insight and your time. We really, really appreciate it.
Thank you.
All right, stay with us. When we come back, we're going to get to your points of view. I'd love to know your thoughts. Do you support a temporary ban of non-U.S. citizen Muslims or not? You just saw that poll where more and more people are beginning to say, hey, maybe this isn't such a bad idea. We want to hear from you. Text us, email us. We'll be right back.